Hi, I'm Dr. Christopher Zoumalan, a board-certified oculoplastic surgeon and also the creator of the natural-looking blepharoplasty technique.
Hi, my name is Eva Josen. I am a registered nurse with Dr. Chris Zoumalan here in Beverly Hills. I specialize in aesthetics, especially aesthetic injectables like Botox, filler, PRP, PRF, Easy Gel, and lasers. Today, we will talk a little more in detail about Botox. Botox is usually the first line of treatment for someone looking to rejuvenate their skin and appearance. Botox is a neuromodulator. What it does, it relaxes your muscle from moving for a certain time period, usually 3 to 4 months. It helps your skin to battle wrinkles and skin folding. For example, frowning repeatedly can create lines in between the eyebrows, also known as 11s, because go ahead and frown again. After frowning years and years in a row, you would create these 2 lines here to engrave in your skin. Botox will prevent the formation of these lines, and if you already do have those lines, Botox will help with smoothing them out. Also, from smiling repeatedly, you can create crow's feet, which are the lines right here around our eye. You can start Botox as early as your 20s. You'll probably need less units, just like Eliza here. She's beautiful. How old are you? 23. We will go very gentle and minimal on her. And if you are in your 50s or past your 50s, we'll probably use more amount of Botox. The treatment is fast and fairly not painful. Patients describe it as a small pinch. We do offer numbing cream, and the procedure takes about 15 to 20 minutes. It could be your lunchtime procedure. It takes about 2 weeks for you to see the peak results. For the first day, you should avoid any hot showers or saunas, or laying down with the face flat down, or looking at your phone for a long period of time. Botox results usually last from 3 to 4 months. Sometimes it could last even longer, up to 6 months. It depends on your lifestyle, how often you exercise, how often you sweat, and how fast your body will metabolize the product. Yes, you still will be able to make expressions. If it's injected correctly, you do not just freeze up. If the Botox is injected correctly, you still have your facial expressions, but those folds, those skin folds, will not be so deep. Starting Botox early will prevent the wrinkle and line formation. If you already do have the lines, then it will help with smoothing them out. So there's no such thing as starting Botox too early. The earlier you start, the more wrinkles you will prevent. If you have more questions or you're looking for a practitioner who will deliver natural results, reach out to us to find out if you're a good candidate to start Botox at any age, whether you're in your 20s, late 30s, or 50s.